Hi, my name is Sanchi Namdi, and I am a graduate student at the University of Nevada, Las Vegas, and I will be presenting to you a family nursing theory presentation. What I will be going over in this presentation is an explanation of a theory in family nursing, key concepts of the theory, and an explanation of how they are linked, a description and summary of how the theory is used in family nursing care practice, and a discussion of evidence-based research that has been guided by the theory. I chose a family systems theory because it looks at the family unit as a whole, whereas us as nurses are usually typically used to giving care to the individual client. So it's very important in family nursing to be able to integrate the whole family into the unit to be able to give the best amount of quality care. The family systems theory has four key concepts. These are all parts of the system are interconnected, the whole is more than the sum of its parts, and all systems have some form of the boundaries or borders between the system and its environment, and systems can be further organized into subsystems. Concept one is when all of the parts of the system are interconnected. This means that when an individual in a family experiences a health event, all the members are affected because they are connected. Concept two is the whole is more than the sum of its parts. This means that the family as a whole is composed of more than the individual lives of family members. Concept three is all systems have some form of boundaries or borders between the system and its environment. This means that boundaries are physical or abstract imaginary lines that families use as barriers or filters to control the impact of stressors on the family system. Concept four is systems can be further organized into subsystems. This means that in addition to conceptualizing the family as a whole, nurses can think about the subsystems of the family. These subsystems take into account the three dimensions of family, which are structure, function, and processes. In this slide, I decided to choose a table that further describes the definition of the basic concepts in Bowen's family systems theory. The family systems theory was first introduced by the psychiatrist Dr. Bowen in 1985. This was a useful framework for examining and changing patterns in nurse-patient relationships. It can be used to describe relationships within families and among families and healthcare providers. Bowen developed family systems theory after years of observing families both with and without a mentally ill member. Bowen noted similarities between the dynamics of family interactions of both types of families. Bowen called the constant exchange of emotions observed among family members the nuclear family emotional system. The underlying assumption of Bowen's theory is that chronic unrelieved anxiety lies at the core of the family dysfunction. Attempts to reduce anxiety may result in dysfunctional family coping behaviors. The family was seen as a system characterized by a constant interplay of emotions that occurs as family members attempt to manage the anxiety existing in the family system. The central goal of Bowen's theory is to increase differentiation within the family to improve the management of anxiety. Bowen conceptualized the family as an emotional unit. He also conceptualized the environment to include the immediate nuclear family, the extended or multi-generational family, and the broader social systems. Bowen conceptualized health as being experienced by the family to the extent that each of its members is differentiated from the other members. He also conceptualized that nursing in this theory is to strengthen healthy relationship patterns and assist the family in developing skills of healthcare management. Differentiation refers to the degree to which family members are emotionally separate from each other and able to distinguish thought from emotion. Highly differentiated people make more rational decisions and sustain an identity that is separate from, yet connected to the family. Less differentiated people make decisions that are based on feelings. The goal is to be able to have highly differentiated members of the family. Bowen's multi-generational transmission refers to the handling down of anxiety from one generation to the next. Family history provides a template for current family coping mechanisms. Thus, conflict in one generation may be the result of unresolved disputes in prior generations. That's why, as a family nurse, it's great to be able to get the family's genogram and do an eco map. Triangling is an anxiety management behavior in which tension between two family members is reduced by pulling a third party into the relationship. An example of this would be a very close relationship between a mother and daughter which may develop to offset tension between the mother and father. These are very important clues to look out for as a family nurse practitioner to be able to work closely with the family and understand the family better. Triangling in clinical practice is important for the nurse practitioner because when a triangle persists, it limits the family's ability of coping behaviors as the members of the triangle repeatedly play out the same roles. Rigid triangles limit the family members' flexibility and creativity in solving problems. This can occur in situations such as in critical care settings, in psych nursing, and just in regular family practice nursing as well. Goodall and Hansel explained how family systems theory in clinical practice, specifically in critical care, can be very important for the family nurse. Families come in contact with critical care nurses during times of transition and crisis, such as illness, injury, and death. During these periods of crisis, critical care nurses have the opportunity to enhance family strengths, detect dysfunctional patterns that may impede recovery, and enhance coping in both present and future family crises. This theory is very important in critical care as nurses sometimes make the assumption of family members in the critical care setting. So this theory says that visiting privileges and access to information can no longer be reserved for those with a direct genetic or marital relation to the patient, as we broaden the definition of family to include all those whom the patient identifies as family. Requiring a genetic link for visiting privileges and access to information is inappropriate in modern society. Although the majority of critical care nurses' therapeutic actions must focus on the hospitalized family member, Bowen's theory makes it clear that the family as a whole is affected by the illness and must be nursed as well. Goodall and Hansen stated, in such an environment, it is important that healthcare professionals be able to differentiate themselves from their patients and families as well. Goodall and Hansen's analysis on Bowen's theory found that nurses should note strong emotional reactions in themselves to certain patients or their family members because these emotions may signify that the nurse is being drawn into the family system in a reactive and untherapeutic manner. Another way this helps in clinical settings is that nurses who find themselves frequently drawn into family emotional systems need to examine their own levels of differentiation. A doctoral study that was guided by Bowen's theory was used in marriage therapy, which can also be used in psych nursing and the emergency department as well. This study displayed a non-anxious, differentiated, and objective presence, which was introduced into the emotionally reactive, subjective, and undifferentiated marital system. Utilizing the co-therapeutic model to enhance male-female differentiation, the therapists model unconditional position taking, objective examination of feeling states, and detriangulating maneuvers. The findings from this study show that the Bowen approach is intensely personal and subjective in that it requires a conscious commitment to one's own differentiation. Therapy cannot be experienced separate from the processes of one's personal life. Knott's research in 2003 was another research that has been guided by family systems theory, and this research mainly focused on secrets within the family. Secrets, although their frequency and intensity may vary, can be found in every family. This study found that the presence of secrets represents intensity and anxiety in the family and limited family relationships. The interpretation of Knott's findings in 2003 showed that the illustrative clinical case study provides support for the effectiveness of Bowen's theory to explain the phenomenon of family secrets. The observed patterns within the family in the case study conformed to the predicted patterns derived from Bowen's theory. The illustrative case study is important in that it makes a significant contribution to the understanding of the phenomenon of family secrets. I chose this theory for my family assessment assignment because it focuses on the family as a whole and focuses on successful relationships within the family. And as a family nurse, you do just that. You focus on the family unit as your sole client rather than just looking at the individual solely. I will be applying this theory into the family I will be assessing by using Bowen's 4 concepts and exploring successful differentiation of each family member. Attached are my references, and thank you so much for allowing me to present to you my family nursing theory presentation.